I do public meetings all over Vermont and all over the country. And I always ask one very simple question, and that is the American healthcare system broken? And that is the answer we get all over the country. The function of a rational healthcare system is not to make billions for the insurance companies and the drug companies. It is to provide quality healthcare to every man, woman, and child as a human right. Today in America, and a lot of folks don't know this, we spend twice as much per capita on average as the people of other countries. And yet, despite spending over $14,000 for every man, woman, and child on healthcare, 85 million of us are uninsured or underinsured. And we have 68,000 people every year who die because they can't get to a doctor on time. Can you imagine that?
In Washington, D.C., a wave of energy swept through the nation's capital as hundreds of nurses, union leaders, doctors, patients, and lawmakers rallied for one bold demand: Medicare for all. Chanting union power and "When we fight, we win." Nurses clad in red took center stage, pushing for a complete overhaul of America's healthcare system, one that treats healthcare not as a privilege, but a human right. Senator Bernie Sanders joined the movement, telling the crowd what many Americans have long believed: the U.S. healthcare system is broken. Despite spending more than twice as much per person on healthcare compared to other countries, tens of millions remain uninsured or underinsured. According to Sanders, this system leaves 68,000 people dying annually because they couldn't afford to see a doctor in time. Standing alongside Representatives Pramila Jayapal and Dingell, Sanders unveiled new legislation to establish a single-payer, government-funded healthcare system. The bill promises universal coverage, eliminating co-pays, premiums, deductibles, and surprise bills. Everything from vision, dental, and mental health services to prescription drugs and long-term care would be fully covered. Jayapal emphasized the injustice of allowing private insurance companies to profit from denying claims. She cited staggering statistics: 100 million Americans in medical debt, and 85 million with inadequate coverage, despite historic corporate profits in the healthcare industry. Representative Dingell, who has carried on a family legacy of healthcare advocacy since the 1940s, spoke emotionally about real families forced to choose between food and medicine. She recounted stories of patients cut off from care simply because they lost a job, one of the many failures of an employer-based insurance model. From veterans nurses to working mothers, the message was consistent: the current for-profit model is not only ineffective, it's cruel. Bonnie Castillo, president of National Nurses United, said nurses won't back down. "We're stepping up," she declared, pointing to the daily struggles they witness in hospitals across the country. Dr. Sanjeev Sriram, a pediatrician, reminded the audience that healthcare justice has always been a people-powered movement. From desegregating hospitals in the 1960s to today's fight for universal care, real change begins with grassroots momentum. The rally wasn't just about policy. It was deeply personal. Stories of loss, sacrifice, and resilience poured from the stage. Larry Stafford shared how his aunt delayed treatment due to a lack of insurance. By the time she saw a doctor, it was too late. He, like many others, said no family should have to bury a loved one simply because they couldn't afford care. Public Citizen President Robert Weissman and American Postal Workers Union President Mark Diamondstein closed out the rally by calling for an end to corporate greed in healthcare. Their message: Americans don't want to protect a system that profits from suffering. They want a system that serves everyone. With over 100 members of Congress already backing the bill and hundreds of local governments passing resolutions in support, the push for Medicare for all is gaining ground. Organizers say this movement will not stop until healthcare is treated as the basic right it should be for every American, without exception.